In the heart of Gombe State, Nigeria, a devastating reality unfolds. Women who use drugs face arbitrary arrest.
Ina cikin gida jami'an tsaro suka zo suka kama ni har cikin ɗaki na.
Brutal treatment and debilitating health consequences. Their stories, often shrouded in silence and stigma, are a testament to the urgent need for change.
In communities that we visit, we find out that they are being discriminated upon and people stigmatize against them a lot.
They face stigma, people at the facility don't attend to them on their own.
In Gombe State, women who use drugs are trapped in a vicious circle of addiction, arrest, and abuse. Meet the women who dare to speak out and the advocates fighting for their rights.
Hello, my name is Musa Miriam Jerida, the care officer at DAPHO, Drug-Free and Preventive Healthcare Organization.
My name is Hannatu Adamu Ankule. I work with Drug-Free and Preventive Healthcare Organization, DAPHO, here in Gombe.
My name is Nana Sarah Simon. I am the Monitoring and Evaluation Officer on the VIF project.
Sunana Amina Ibrahim.
As a DAPHO paralegal, my work is multiple within the community. I mobilize community members. I also stand for their rights.
The physical wounds of injecting drug use are just the beginning. Stigma and discrimination cuts deeper.
In communities that we visit, we find out that they are being discriminated upon and people stigmatize against them a lot.
If they go to the hospital, they will be discriminated, or most of them they will be stigmatized.
Our major challenges is women facing stigma, being discriminated in the society, the community, and at the facility.
Here are the stories of women who have been marginalized and the healthcare workers fighting to save their lives.
Rayuwa yau da gobe haɗuwa da ƙawaya ka iri wannan. Hannu zo na fara alluran fento.
I started injecting penta as a result of peer influences. I got injuries on my leg as a result of injecting drugs. The DAPHO are the ones who treated me and started convincing me to reduce the frequent injection. When my hand was seriously wounded as a result of injecting drugs, the DAPHO took me to the hospital and they said my hands must be amputated. At first, I didn't agree with them, but with their convincing efforts, my hand is amputated and I am now healed and mingling with other people. I cannot mingle with people because of depression when I had the wound at first. But after DAPHO came to my rescue, I am now healed and healthy. I thank DAPHO for these efforts. Before my encounter with DAPHO, I take drugs anyhow, and I smoke any kind of weed and cigarettes. The time I started injecting drugs, I got wounds on my leg and hands. I was thinking the wounds are not that serious. The wound kept expanding.
Ina zaune a ɗaki na ranar 11 ga wata, da wannan watan 11. Sai 'yan sanda suka shigo suka kama ni a ɗaki, suka kama ni, da suka kama ni ban yi musu gardama ba. Na biyu su muka je suka sa ni a nafe a kofar gida na hau muka je. Sai ina kiran waya zan kira oga dawa a kan zo ya taimaka min gashi an kama ni. Sai ɗaya daga cikinsu sai ya ce min in kashe waya One of the officers bluntly asked me to off my phone. I said I can't because I want to call the person that would bail me. He then started beating me and wounded me inside the tricycle. They then took me to the police station and got veiled eventually. The security agencies came and arrested me in my room. They took me to their office, from their office to the court.
We have been working with women who use and enjoy drugs here in Gombe for some years now, and we have been conducting outreaches in several hotspots and in several areas here in Gombe.
The cases that they are bringing about to this hospital, the majority of them are people with substance abuse. And the substance abuse, they get infected after some time. And there is this particular index case that was brought in. A woman with infected right upper limb. She's been a patient that has been abusing a particular substance and injecting her hand in the right upper limb. And the woman got infected. She was seen in the clinic and then at the emergency room before referring to the surgical outpatient clinic, where I happened to do my own consultation. And on getting to see her, the right upper limb was infected with a lot of dead and dying tissues involving the right upper limb, and it's even spread to involve the left breast. So this woman had to be admitted, and the treatment is sponsored by the people that brought her to the clinic. And the essence of it is that they are responsible for the drug, for the payment of the theatre, and even for our feeding on the ward. The patient had to be brought to the theatre twice. Initially, we had to remove the dead and dying tissues that are there, and then we continue with our wound care. And after the wound has granulated and looks appealing very well, then we now have to take her back to the theatre to go and remove skin, in a part of our body to be able to cover that the left upper limb, so as for her to be able to gain the functionality of that hand also. And then we also were able to take care of the part that is involved in the breast. So all these are courtesy of the people that brought her. And most importantly, this woman was equally pregnant, and because of her pregnancy, we had to invite the people that are involved in it, that is the obstetrician, to come and look after the pregnancy that she has. We also had to employ the service of the psychiatrists and the psychologists for them to be able to assist us in order to be able to talk to her, so that she doesn't go back to where she was coming from, that is from the substance abuse, so that she know the importance of not abusing drugs for our own benefit and the benefit of the other people that are in the community and our own children also.
We create a good relationship between us and the client that DAPHO usually brings. So we treat them as our sisters, our daughters, and our mothers, sisters whatsoever. We have a good relationship with them. We deal with screening of precancerous lesion, breast issues, including mastitis, engorgement, inverted nipple, cracked nipples. We did treatments on precancerous lesion, and if we have a suspicious lesion, we do refer to medical center for expert management. We have about 3 clients that we, at first, they came here for screening. We screened and found that there is a lesion. So we take a biopsy of the lesion. The result came out with cervical carcinoma in situ. And we referred her to medical center for expert care. We do follow the patient up. She had a surgery, and up till now, yeah, alhamdulillah, she's successful. The treatment was fine and good. Still, we are having contact with the patient that she's feeling better now.
But there is hope. DAPHO's innovative approach provides paralegal support, wound treatment, and care.
The VIF project is a project that centers around women who use drugs, and then the project renders services like harm reduction, sexual and reproductive health, and also human rights services to them. And then the project has been a project that works basically for women that use and inject drugs in the state. At the commencement of the project, we were working within Gombe local government, but then the project has been upscaled to other local government, like 7 local government of the state. And then so far, we've been able to render these services to these women in these 7 local government we've covered.
I have 2 clients that access the wound treatment services here in the State Specialist Hospital. One of the clients herself have been in the hospital on admission for 3 months. Yes, successfully we escaped amputation, right? Yes, because previously we have clients that, due to the extent of the wound, she had to be amputated. But for this recent client, we escaped amputation. But the client has been in the hospital for 3 months. So there were a series of surgeries, treatments, medications, and all that. She had 3 surgeries, as I've said: debridement repair due to the clients not meeting up with their medication. So we have to come in fully with that, with their medications and all that, the surgery fees and everything. It was 100% work done by DAPHO. So regarding that, then the skin grafting, that was the final surgery that was made for the clients, where you take the healthy wounds and cover where there is an unhealthy tissue. So after that, for quite some time, the client was discharged. So we thank God that she actually escaped amputation. What the clients enjoy most is the relationship you have with the staff you get. Now, you have to give that impact in their life. You have to be there for them. So it's basically what has been helping us. It's basically what has been the best so far. Just talking to the clients really enjoyed the services you render. The way you talk to him, the way you address him, the way you're concerned about him. So with that, they actually enjoyed the services rendered, not just them coming into the facility and getting treated and all that, but the process that from day 1 to the last day that DAPHO has been with them. So by that, they actually refer their peers. This has encouraged them to talk to their peers. Okay, come out if you have this wound and all that. So we are actually very observant. Also, when you go to the community, you will see a lot of things. Some of things you don't see, but you have to be very observant so that you understand the responses of a client. So with that, women have actually come out and tried to report their case, their condition, what they're facing, and with that, a lot of women have been helped so far.
We take them there by ourselves. We don't just tell them to go there. We carry them there so that they will feel loved. They will feel that they are not alone. and they will feel comforted if we go there with them.
As a DAPHO paralegal, ayyuka na suna da yawa within the community, whereby akwai mobilization na community.
As a DAPHO paralegal, my work is multiple within the community. I mobilize community members. I also stand for their rights.
Or verbal abuse, or kuma showing stigma wa people living with HIV and AIDS. Look, we can stand for the person and also fight for his right.
A role of paralegal to make sure the life-being of the community health has been supported in terms of taking their drugs, and those who inject or take drugs to make sure they take it in the right time. A lady with her fiancé or boyfriend, I don't know, they call me that they have an emergency, which I did. I go there, I collected the vital information, and I promised her that our organization is going to take good care of it, and they are going to support her in any way. I submit the case to the organization, which we promise her that we are going to tackle all the issue in the right time, because she keep on complaining that they have collected their money in the station, which vividly that we don't give money in our organization. We only support and make sure the well-being of the community has been rendered in the right time.
Before we meet DAPHO team, our lives are being depressed because of the stigma from the community, and we were primitively unaware of our rights. As a result of emergence of DAPHO, we now know and push for our rights. I am a HIV positive. Before DAPHO came to my life, I don't know where and how to look for a cure medicine. But because of DAPHO, I can easily access the cure medicine, and I have the privilege to enroll my peers in the project also. As people who inject drugs, we faced a pungent stigmatization, but DAPHO came to our rescue in that aspect too, and now we have rights. We also faced both gender-based and intimate partner violence, but DAPHO has stopped that. DAPHO team are supporting us with our basic needs, such as food, medicine, clothes, amongst others. May Almighty bless all that have contributed to this project.
Witness the impacts of compassion and advocacy on the life of women who use drugs.
You have to, first of all, have an interpersonal communication with the clients. You have to also examine the client so as to allay anxiety. You know, people, when you're free with them, when you're open, when you talk to them, when you give them time to open up, so they'll tell you the problem. You have to ask the history. Okay, how long have they been injecting the wound? How long have they sustained the wound due to injection? We call it the wound abscess. So after that, after talking to the clients, totally we need to allay anxiety at all, because taking them to the facility where they have that notion of, okay, they face stigma, people at the facility don't attend to them on their own, so we have to take them personally to the facility, to the health center.
We go as far as going to their houses. We go to their houses when we go for outreaches, and there we encounter such issues. We talk with them, they explain to us that we have been suffering from this, but we don't want to come out because of this issue that we're having. We don't want to be stigmatized, we don't want to be discriminated. But through our outreaches and our interpersonal communication with them, we have been able to reach out to them, and they have confided in us to the extent that we can take them to our facility.
We have been able to provide an enabling environment for women who use drugs, and we have been able to give a visibility to these women, not just at the local level, but at the national and also at the international level. In this regard, as DAPHO, we have improved the quality of life. That's the health and quality of life of women who use drugs, including their dependents. Yes, so far we have had diverse success stories. In fact, we have a story of one of our staff who was once at the community. Because of our services provision, today I would say that she is indeed a success story, because she has improved. We have been able to improve her life, and she has been able to gain employment into our organization, and we are proud to say that we are making and we have made great impact so far.
DAPHO team are supporting us with our basic needs, such as food, medicine, clothes, amongst others. May Almighty bless all that have contributed to this project. When you start taking your curing drugs and you suddenly stopped, it is like you throw stone to a hive of bees. The virus will be stronger and affect pungently in your body. Therefore, you better take your curing drugs as appropriately prescribed. When they are finished, come back and take more, or you call our numbers for guidance. You better speak than to stay silent.
As women who use drugs find their voice, they are breaking the cycle of stigma and oppression.
I help my peers who inject drugs and have HIV by connecting them with DAPHO to access a proper health care. And I work to protect my peers from abuse of any kind. My advice to my peers is that they should not engage themselves in injecting drugs. We that are currently in these activities, may we successfully quit the activities. We are also advocating for a job so that we become self-reliant. If we have someone that will help us with a job to do, because we are presently unemployed and we are tired of begging from others. We are now fully informed from DAPHO's awareness and sensitization, and I want to use this medium to give a vote of thanks on behalf of all the beneficiaries that are injecting drugs to the able DAPHO for the contribution they are giving to us. Thank you. I came in contact with DAPHO when they came to our community for sensitization, and my meeting with them has positively changed my life entirely. My life had no focus before I met DAPHO.
HIV testing,
I only
STI,
smoke,
the cervical cancer, the
get
adherence
drugged,
counseling,
and be
psychosocial
wandering
support.
on the street. But my contact with them changed everything. As I'm speaking to you now, I do not have time for smoking, drugging, because of how they engaged me to be one of their staffers as a community facilitator. I benefited from HIV tests, STI tests, cervical cancer tests, adherence counseling, and psychosocial support. The difference between my previous life and now is that I positively managed my time through reading, as well as impacting positively to the lives of my peers.
Join the movement, demand change. Support organizations like DAPHO in their quest for justice and compassion.
And we plan on coming up with a long-term sustainability plan for these women who use and inject drugs. And one of such is the VATAT Center. VATAT stands for Vocation as Therapy Against Drug Dependence. These centers is majorly for women who use drugs to learn skill acquisition, to learn skills such as henna, hair making, barbing, and then shoemaking. So with this, it can take them off the streets and then give them a say in the society. And then by the time they get to learn these skills, they can stand for themselves and even their children.
Our idea is over time we try to do this kind of empowerment where we buy machines and give to people and say, that was not on the big project. And we give to people and say, oh, then most times they end up selling it. So what we decided is, after the training, if you get a job you want to do, you can always come to these machines. You will always be here to provide the lights, to provide the machines for you, service them, make them more. So if you learn how to make shoe and you are yet to establish your own place, and you get someone who wants to make shoe, you can bring it here and use the machines, and give us part of the commission to do the place run.
The struggle is real, but so is the hope. Together, we can create a world where women who use drugs are treated with dignity and respect.
Okay, the general public has this notion about women who use drugs. They believe that we that work and support them are actually encouraging them to continue taking these drugs. In case you have the same notion, I just want you to understand that we are not actually encouraging them, but we are just trying to see that they minimize or entirely stop drug use, because we have a lot of services we render, and part of those services is harm reduction. We teach them how to minimize harm in drug use, and then some of them even undergo rehabilitation. I want to use the opportunity to thank the Gombe State government for their constant support, not only towards this project, but towards the organization at large. And then I want to thank various stakeholders across the state, which cuts in like the NDLEA. We talk about the National Human Rights, talk about the Nigerian Police Force, and so many others. So we are using this opportunity to thank them and then appreciate them for their constant support and efforts. And then especially I want to thank the State Specialist Hospital Gombe
who have been there, especially in the aspect of cervical cancer and then wound treatment. We really appreciate their effort towards this.